Hey everybody, Randy Kertz here for Bass Musician. So this month I would like to talk about something that affects us bassists more, which is ulnar tunnel syndrome. I've talked about that in the past. Ulnar tunnel is when you have discomfort, numbness, tingling in the fourth and fifth, usually the fifth more, fingers respectively. And this is due to impingement of a nerve that goes to those fingers, unlike carpal tunnel, which goes to the thumb, index, middle finger, and sometimes half of the ring finger. So on the right hand, as we've talked about before, many times this is going to be because players will be having their wrist bent and off to the side like so. When you do this, not only down in this extra flexion, but off to the side, that shuts down this area here, which gives the nerve supply to these muscles, causing muscles in the forearm to tighten, causing numbness and tingling in those fingers. And the best way to avoid doing that, as I said, is to just sort of straighten out your hand a little bit so it's not shutting down those fingers in that way. Watch your wrist angle and also not have it go off to the side so much like that. But what happens when it's on your left hand? So I've noticed this not only with patients but with myself, and I've discovered something interesting in that it's not even so much technique on the left hand, which it certainly can be for the same reason when you have your hand in excess flexion and off to the side, but I notice it more because when I sit on seats, whether it's in my office or on airplanes or in waiting rooms or whatever it may be, I'm either laying my forearm on a surface in which there's either like a metal or a wooden rest, or some sort of hard plastic over it, or some kind of fake padding that actually wears away. And so what happens is when you put your arm on this, your body automatically sort of finds a groove, which is this groove right here, which is what goes to the fingers, as I said before, the pinky and the ring fingers. So this groove is right in here, right next to the elbow. If I'm with palm up, it's off to the right, and there's a little groove there that's commonly what people call the funny bone, even though when you whack it, it tingles and there's really nothing funny about it. But anyway, that's what gives you these problems and can give you the numbness in the fourth and fifth fingers. So when you're sitting somewhere, as I've talked about, and you've got your arm on a rest, if you catch yourself with your this area right here, this groove right here, sort of finding its way onto that piece rather than just resting your arm flat, that may be the cause of troubles in the fourth and the fifth fingers on the left hand, assuming you're a righty and you're playing right-handed. Okay, so that's the tip of the month. Not really so much technique in that regard, but as awareness, again, got your arm flat on some surface like that, watch that there's not something pressing in this area right here in this groove, which can cause pain, impingement, numbness and tingling in these fingers, either during the fact or later on when other things can aggravate it as well. Be careful about that. Lay your arm flat or have it at your side or in a better position. Randy Kertz signing off. Always available at www.drkertz.com, where I am available for Skype consultations, and my book, The Bassist Guide to Injury Management, Prevention, and Better Health, is available there and also at bassbooks.com as an ebook. See you next month. Happy Thanksgiving.